Health Organization's Director General, Dr. Tedros Adhanom Ghebreyesus, has said that diseases like cholera, Ebola, and COVID-19 are on increase, while some countries like Uganda have seen a massive surge of cholera. The WHO board said his office has issued an appeal to over $81 million to support the delivery of immunization and other life-saving health services. Here's more details of that in this report by Maria Macha.
Cholera is an extremely virulent disease that can cause severe acute watery diarrhea. It takes between 12 hours and 5 days for a person to show symptoms after ingesting contaminated food or water. It affects both children and adults and can kill within hours if untreated. The World Health Body raises concern about the recent resurgence of what it described as a deadly outbreak.
After years of declining cases globally, we have seen a warning upsurge of cholera outbreaks around the globe over the past year. In the first 9 months of this year alone, 27 countries have reported cholera outbreaks. Not only are we seeing more outbreaks, but more deadly outbreaks. But with an increasing number of outbreaks, supply cannot keep up with demand. We urge the world's leading vaccine manufacturers to talk to us about how we can increase production. Cholera thrives on poverty and conflict, but is now being turbocharged by climate change.
Speaking to reporters in Geneva, Dr. Tedros said so far 63 confirmed and probable Ebola cases have been reported, including 29 deaths in Uganda.
10 health workers have been infected and 4 have died. 4 people have recovered and are receiving follow-up care. The vaccines used successfully to curb recent Ebola outbreaks in the Democratic Republic of the Congo are not effective against the type of Ebola virus that's responsible for this outbreak in Uganda. However, several vaccines are in various stages of development against this virus, 2 of which could begin clinical trials in Uganda in the coming weeks, pending regulatory and ethics approvals from the Ugandan government.
Director General Ghebreyesus said the organization is continuing to support the government of Uganda in responding to an outbreak of Ebola disease in 4 districts. Speaking of a vaccine for the cholera outbreak in Uganda, the WHO's chief scientist Dr. Sumaya Swaminathan said there are 2 vaccines available, but they are yet to identify one.
There are 2 different candidates, one from the University of Oxford and one from the Sabine Vaccine Institute. There are very limited doses available, unfortunately, of both of them. There is raw materials, so there has to be some fill and finish to make the product ready. Now, which of these 2 will actually go into the trial may depend on when the doses, which one actually has doses to deploy. Sooner, it would be good to, of course, test as many vaccines as possible.
Given updates on COVID-19, the WHO boss said cases will increase but not necessarily deaths as long as precautionary measures are available like vaccines.
We expect reported cases of COVID-19 to increase, but the deaths don't have to, given we have vaccines and therapeutics that can save lives. Measures introduced to curb the spread of COVID-19 during the pandemic also help to reduce the burden of flu. But with most of these measures lifted, flu is back and should not be taken lightly. Flu vaccines are safe and effective in reducing severe disease and death, especially among the most at-risk groups. So please get your flu vaccine.
Several African and Asian countries have reported cholera outbreaks in 2021 and 2022. Major ongoing outbreaks are being reported from Afghanistan, Bangladesh, the Democratic Republic of Congo, Ethiopia, and Nigeria. With regards to COVID-19, the WHO said it is expecting more recorded cases, but no deaths as far as measures are followed accordingly. Reporting for Eyeafrica News, I am Yahya Jammeh.